Hi, this is Mr. Burke. I'm going to be going over the step-by-step process on how to deal with an unconscious victim. Now, I'm going to be talking to you from the point of perspective of dealing with a child unconscious victim, but you're also going to have to fill out the adult and infant. I'll go over some of the differences in a separate video. Okay. So as you approach the scene and you notice that a victim is lying motionless, face down, all right, one of the things you want to establish is, and this is in your 3 C's that you already did, is just that if the scene is safe for you to proceed. You don't want to become a victim yourself, all right? So as I approach, I'm looking around for anything that could cause the scene to be unsafe. Now in this situation, it is a child. So with a child, you also look for a parent that's present to get consent. If there is a parent consent, you want to tell them who you are, your name, your level of certification, and what you're intending to do. So it would be as simple as, hi, my name's Mr. Burke. Okay, I'm currently first aid and CPR certified. May I care for your child? And they simply, hopefully, respond by saying yes. If they refuse care, you want to simply oversee visually, call 911 if you deem necessary, and then move on. But in this situation, we're going to go up. If the parent's present, we're going to get consent. At this point now, I kneel down, and with the child, I'm simply going to tap them. Hey, are you okay? If there's no response, immediately, if the parent's present, I'm going to tell them to call 911. This is all still in step 1. So getting consent, all right, establishing if they're unconscious, which is, hey, are you okay? And having either parent call 911 or yourself call 911 is all in step 1, all right? Now in step 2, since they're face down, we don't want to move them if they're breathing. So what I'm going to do is I'm going to get as close to their windpipe as possible. You open in their mouth, looking to have my vision towards their back to look and see if their chest is, their back's rising for breathing. All right. If they're not breathing, or if I can't establish any breathing at this point in time, and a victim that is face down, I want to carefully and effectively get them onto their back. So I'm going to support the head and neck with one hand. All right. Put my other hand on their side and roll the victim towards you, still supporting. At this point in time, since I've already established that they weren't breathing, I would just start CPR right away, okay? And a victim that was face down, start CPR right away, which that'll be a separate video, okay? Now, if I come across the victim and starting from the beginning in step 1, and they're already face up and say the parent is not present, implied consent comes into play. Hey, are you okay? There's no response. I'm gonna call 911. That's all step 1. Step 2, it's a little bit different since they're already face up. I'm going to use what we call the head tilt chin lift, where I apply the palm of my hand on the forehead, 2 fingers underneath. This is step 3, okay? And I'm going to look, listen, and feel for about 5 to 10 seconds. Again, victims face up, they're not breathing, I would immediately begin CPR, okay? If I come up, all right, and let's just say in step 3, I head tilt, chin lift, look, listen, and feel, and they are breathing, all right, I would put them on the recovery side, put them in the recovery position, which is step 4, all right, which is simply, again, supporting, I'm going to slide my hand underneath the head and neck, supporting the head and neck, and roll them away from you, right there, okay? So, again, reviewing, and I'm going to kind of take you through this step by step. Step 1, okay, if the parent's present in this situation, you want to get consent, all right, by telling them your name, your level of certification, okay, and it could be as simple as I'm taking a first aid and CPR course in health, all right, and what you intend to do, which is just simply providing care. Step 2, all right, the victim's already face up. I'm going to head tilt, chin lift, look, listen, and feel for 5 to 10 seconds. If they're breathing, all right, step 4 is the recovery position, okay? If they're not breathing, on your sheet for this, the victim is not breathing and face up. This is actually step 6. You begin CPR, okay? Again, I'll have a separate video going over the differences.